Go ahead.
Great. So, hello everybody. I'm Paula Whitehurst, and I'm a community pharmacy integration program manager for Joined Up Care Derbyshire. So my presentation today is about community pharmacy services, and I just wanted to raise more awareness of the services that community pharmacy offer, and just tell you a little bit about our work that's going on across Derbyshire. So my first slide, if that works, there we go. So just some background to the development of community pharmacy services is shown on this slide. So back in May 2023, NHS England published a delivery plan for recovery and access to primary care. And two elements of this delivery plan were to empower patients by rolling out tools that they can use to manage their own health. And there was a lot of investment into community pharmacy services over a 2-year period, as you can see there. Another element was to launch Pharmacy First, so that by the end of 2023, community pharmacies can supply prescription-only medicines for 7 common conditions. And I'll come on to that in a moment. You may be aware of those services. So the Primary Care Access and Recovery Plan led to 3 main initiatives for community pharmacy. One being the pharmacy contraception service, the other being the community pharmacy blood pressure check service, and the third being Pharmacy First. And these 3 elements were nationally expected to free up an additional 10 million GP appointments each year. So I'll talk first about the oral contraception service. This is a service available at community pharmacies whereby people can obtain supplies of oral contraception from a community pharmacist without having to visit their GP or sexual health clinic first to be seen. So pharmacists in community pharmacy can initiate oral contraception, and they can continually supply that contraception as well. You can find the local community pharmacy offering this service via a link that I've popped on the slide here, and these slides will be available for you to access after this meeting. And that link there would enable somebody who wanted to go to a pharmacy to get their oral contraception to be able to find a pharmacy that offers that service. We've got really good coverage across Derbyshire for that service now. Over the last few months, more and more people have been trained to deliver that. And so most surgeries across Derbyshire, sorry, most pharmacies across Derbyshire offer the contraceptive service. The service also supports the Women's Health Strategy for England, which highlighted that community pharmacy had a part to play in increasing choice in the ways that people can access contraception. You might have also heard of a separate local authority commission service, which is available, and that service is for emergency hormonal contraception, or what's commonly known as the morning after pill. Pharmacies offering that service are listed on the DCHS Sexual Health Service Finder webpage, and another link is there on the slide to that. You may have heard in the news recently that there has been an update to community pharmacy services, in that the emergency hormonal contraception service will be commissioned nationally from later this year, around October. Both oral contraception and emergency oral contraception will be offered at community pharmacies for patients, and that's nationally. The second element that was on the initial slide is around the blood pressure check service. So some background to why this service came about is because cardiovascular disease is the second most common cause of premature death in England after cancer. It affects 7 million people in the UK. And high blood pressure significantly increases the risk of a person having a heart attack or stroke. So early detection and treatment can help those people live longer, healthier lives. The NHS long-term plan focuses on tackling health inequalities as well, and the prevention of ill health, and is aiming to prevent strokes and heart attacks that result from cardiovascular disease. And there's a bit of an ambition there over the next 10 years. If you were to attend your community pharmacy for a blood pressure check service, the criteria for being able to have a blood pressure check is that you have to be over the age of 40. You have to have not previously been identified as having hypertension or a related condition, and not to have had your blood pressure checked by a healthcare professional within the previous 6 months. There's a little video link here. I won't play that, but you can watch that at your own leisure, just to find out a little bit more about that service. And there is also a link, again, where you can Google that to find a pharmacy that offers blood pressure checks. And that will give you a list of pharmacies in your area once you pop your area into that search engine, that would offer the service. The next slide just kind of gives a bit of an oversight around what would happen if you went for a blood pressure check to your community pharmacy and your blood pressure was normal. The pharmacist would just promote some healthy behaviours and give you any advice that you might need. If your blood pressure was high, the pharmacist can offer what we call ambulatory blood pressure monitoring. That's often called ABPM. And what that means is they have a machine that you can take away and have fitted to measure your blood pressure readings over the next 24 hours. And then once you return to the pharmacy, those readings would be sort of printed off and shared with your GP practice. So that can be offered from community pharmacy for patients that are detected with having high blood pressure. If your blood pressure was very high, the pharmacist would urgently refer you back to see your GP within 24 hours. So they communicate to your GP by NHS mail or however is agreed. If you had low blood pressure, the pharmacist would have provide advice to a patient, and they'd also refer them to see their GP if there were any concerns. So all the blood pressure readings that are taken in community pharmacy are sent to your GP afterwards, and their records there are updated, and they follow up anything that they need to. Your general practice can also refer you in for a blood pressure check should they think that you would be appropriate to have one, and they can utilise community pharmacy to do that and direct you to go there. So the next service was around a pharmacy first service. So you've probably seen a lot in the press around this service. It came about a couple of years ago now, and there are 3 elements to pharmacy first. The first being the clinical pathways. So community pharmacists can see anybody now who may have sinusitis if you were 12 years or over. If you've got a sore throat and you're over 5 years old, you can be seen in community pharmacy. If you've got a urinary tract infection and you're female and between 16 to 64 years of age, you can also be seen by your community pharmacist. Earache patients that are aged between 1 and 17 years old can be seen in community pharmacy and treated. Impetigo and infected insect bites, you would have to be over 1. And shingles is for adults over 18 years of age. So should anybody feel that they have one of those conditions and want to seek advice and treatment for that, they can attend a community pharmacy and just walk in. Equally, your GP practice could triage you to a community pharmacy should you contact them and highlight any of those conditions or what you would like to be seen for. So those 7 pathways work by way of what we call a patient group direction. So it enables a community pharmacist to prescribe an antibiotic if appropriate or other treatment not prescribe as such. It's under a PGD, so it's a patient group direction. So it's similar to obtaining a prescription, but it's a different way of doing it that is covered under that pathway. And you would then therefore get antibiotics if you needed antibiotics. Minor illness is another area that community pharmacies see a lot of patients around. So all of those conditions that are in the box there in the middle, we've always, for a long time now, attended community pharmacies to be seen for advice and treatment around those conditions. So that continues, and again, more and more as we go forward, GP practices may signpost patients with these conditions to see a community pharmacist. Another element is around urgent repeat med supply. So NHS One do refer to community pharmacies patients that might need an urgent medicine supply. So if they've had an issue with their supply, they've run out and not realised that they will be triaged to be seen. So That's covering Pharmacy First and Pharmacy First services. In terms of what we are doing in Joined Up Care Derbyshire, there's lots of work being done across the system and in collaboration with Community Pharmacy Derbyshire, who represent the pharmacy contractors, and Health Watch, who do a lot of public and patient engagement to promote the services that community pharmacy offer. And also help integrate those services into the processes and pathways that we've got in all different NHS trusts and across GP practice. So some of the work that I'm involved in at the moment is I'm working with 3 PCNs at the moment to look at how they can undertake referrals to community pharmacy and do those electronically. So we're looking at that IT side of doing that referral via an electronic method, and looking at how we can train and do more communications to people in the community so that they're more aware of those services. So we've got some work going on there, working in collaboration with primary care networks or PCNs as they are called. UTC means urgent treatment centres, so I'm doing some scoping and linking in with urgent treatment centres across Derbyshire just to see how we can help urgent treatment centres with some seeing patients where we can help with capacity and making sure the right person, the patient is the right person in the right place at the right time. And that also offers increased access so that you've got more places that you can access that might be convenient for you. There's a lot we're doing around communication. So our ICB communications team are helping with utilising some of the national resources around Pharmacy First. There's lots of resources that we can access, like digital screens that can go on GP practice waiting room screens, where what you look at as you're waiting. There's posters and there's social media templates on there where we can put wording and images out to promote some of the Pharmacy First services, and that will highlight to people those 7 conditions, for instance, that can be treated in community pharmacy, so we can raise some awareness of those. Another item that I'm working on is the oral contraception and communications plan. So we're planning to try and increase awareness of oral contraception service, which in the beginnings had low uptake because there was little awareness of it. And we're trying to link in with universities and colleges so that students are more aware of it and know that they can access community pharmacies should they require oral contraception. So we're doing a lot of work around trying to increase awareness of that and ensuring that people know that they can access that service if they want to. This is just a slide just to show those what you might have seen some of these communications. So NHS England have produced these social media assets, digital screens and posters. So you may have seen this digital screen here, Get Well Sooner one on a waiting room, in a waiting room at your GP practice. Some GP practices are doing social media posts across their social media accounts, just to alert people to those 7 conditions and where you can go, being that the community pharmacy. And on the right here, there's a poster, and that poster is just an example of some of the posters that promote those 7 common conditions that I talked about earlier. Another thing that I just wanted to raise awareness of is a national initiative, and it's called Independent Prescriber Pathfinder. So we've got 4 community pharmacies in Derbyshire that are our independent prescriber pathfinder sites. Those 4 pharmacies are Good Life Pharmacy in Hatton, the Medicine Stop Pharmacy in Alfreton, the Pear Tree Pharmacy in Normanton, and the Evans Pharmacy in Breaston. And this is really to support the fact that from 2026, when pharmacists come out of university, they'll all come out of university as independent prescribers. So there's a bit of a shift in the profession and the skill set. And currently we do have pharmacies with pharmacists that do independently prescribe, and they have some private business that they can prescribe for, and they may advertise those services on their websites to patients. So these 4 IP Pathfinder sites, they work with specific practices, so they associate with 1 or 2 practices that are in their local vicinity, and that practice will triage people over to the community pharmacy. And what we're finding is, particularly over Christmas, there's some respiratory illness might be triaged to the community pharmacy, and the patient would attend the community pharmacy to be seen. So those pharmacists in those 4 sites, they see patients around minor illness. So it's a bit of an extension of the Pharmacy First service. So whereby it wouldn't be a medication given via a PGD or over-the-counter sale with regards to minor illness, they would be able to also prescribe for minor illness. So they can see Pharmacy First patients, and they can also prescribe for minor illness, hypertension, contraception, advice and prescribing if needed. And we've got 2 novel models in Derbyshire. They are around menopause and acne. So these are 2 models that we're just doing as a pilot. And that means that those practices that the pharmacist is linked with can refer people to community pharmacy for a consultation to discuss their acne or their menopause symptoms, and the pharmacist would take on that treatment and advise. There is some talk around more around lipid management to support with cardiovascular disease, and that's kind of in the future for us, I think, at this point. Some areas that focus more on minor illness across the board, across our boundaries, and other ICBs, they are focusing on minor illness and therefore see patients from anywhere. But in Derbyshire, our models, with having those kind of specific ones around menopause and acne, they are more working alongside GP practices. So you would have to be a Derbyshire patient to be able to access the IP Pathfinder service in Derbyshire. This is a pilot going on for this year, and that will evolve into the next stage of what IP Pathfinder is. So we anticipate that could be rolled out nationally to be more permanent, and we're just seeking more information as we go along, and what we are feeding back from, or the feedback that we get from those community pharmacists will in effect help to look at what will happen next nationally. I just really wanted to end on a final slide here, just to kind of demonstrate on this infographic a summary really on how community pharmacy supports the integrated care system of Derby and Derbyshire, and some of the key priorities that we have to work on. It kind of gives a bit of a summary in this slide. So, we talk a lot around cardiovascular disease and how can we improve the care around that for people. And NHS community pharmacy teams in Derby and Derbyshire have done 32,586 blood pressure checks. This time period is between April and December of last year in 2024. The infographics only updated every quarter, so I'm just awaiting a new update, but just to give you a little bit of a sense of what's happening. This shows that many blood pressure checks had been done last year, and 976 of those people went on to have the ambulatory blood pressure monitoring, so they had the monitor fitted. Now, assuming those patients comply with management plans that are put in place for them, we could then prevent 8 deaths, 15 strokes, and 10 myocardial infarctions, from that service being in place, which is really, really positive and good to see some outcomes of what we are doing. In terms of urgent and emergency care, or discharge medicine service, which I've not covered today, but there is a service more related to hospitals, and the community pharmacies across Derbyshire have completed 9,409 discharge medicine service referrals, and there's some analogy there that we can equate that to avoiding 941 hospital readmissions. And then a huge saving, as you can see there on the slide. So hospital admissions reducing, those saves the NHS money, and also prevents that person having to go into hospital. In terms of access, Pharmacy First has seen 56,937 patients, and that equates to 9,490 hours of potentially GP practice time that's been saved, so that they can focus on the conditions that they need to see, and community pharmacy can play a part in helping see people. That equates to 10 additional full-time clinicians that time has been saved off. The oral contraception service, we had seen last year 3,962 consultations. We do see that growing as people are getting more aware of that. And those pharmacists completed either initiation or ongoing supply of that oral contraception for those people. So NHS community pharmacies are really helping to improve access to contraception. It gives another place for people to go to access that service. So that really helps with planning and preventing unplanned pregnancies. So I just wanted to end on that note really, and give you some idea of kind of what outcomes all of these services do contribute to. And I'm happy to answer any questions that anybody may have on any of those slides.
Paula, thank you very much for that. That was a great presentation. There's a lot of important stuff there, which the pharmacists do, which maybe people aren't aware of. So what we'll do first is we do have some questions in the chat, which I'll read out. If anybody else has a question and wishes to read out their question, then please raise your hand and I'll get to you. So the first question is from Colin, and he's asked, do community pharmacists have GP appointments for the patient's GP surgery? Because where I live, getting a GP appointment at my local surgery is almost impossible.
So I might just need you to elaborate a little bit more on that. So in terms of community pharmacists cannot book GP practice appointments, if that's kind of part of the question.
Colin, are you there?
Yes,
Colin?
I am, yes.
Yeah, can you elaborate for Paula, please? I did put something in the chat just to establish, are you talking about the pharmacist doing appointments at the GP practice, or arranging GP appointments at the pharmacy or something?
No, I just got the impression from what Paula said that the pharmacist, if they felt that the patient needed to be seen by their GP surgery, that they could arrange to make appointments. That's just how I read what you said, Paula. But are you saying that it's different to that then? So
I suppose, yeah. So in terms of if you've been seen by a community pharmacy for one of the so say you had a blood pressure check at your community pharmacy, for instance, and you needed an urgent referral back to your GP practice, communication would go through to the GP practice, and then it would be so the GP practice would then have to make sure they contacted the person to ensure that they are seen and that they get an appointment if that's appropriate. So there is a communication mechanism. Does that help in terms of feedback? Yeah, so when you're seen by a community pharmacy, feedback goes back to your GP, and that will go in your record as to the fact that you've been seen, if that helps.
That explains it a lot better, that that the GP service, it's then their responsibility to contact the patients, and they should I didn't quite get that when you explained it, so thanks for that.
Okay. Yeah, and I can give further detail on that. There's what we call a service specification, and that kind of outlines exactly what responsibility the community pharmacists have got and exactly what they've got to do. And the detail is kind of in that specification, if that helps.
Yes, well, that way there's probably more chance of, say, me getting an appointment at my GP service than if I tried to do it myself. So I'm pleased about that. Thank you.
Okay, the next question is from Harp. Can I assume that those materials, the promotional leaflets, etc., are suitable for those who are neurodivergent and for those for who English is a second language?
Really good question, Harp. And as those resources have been designed and developed by NHS England, obviously we've not screened those resources. And any feedback on those resources, we can cascade back to NHS England if that's helpful. If there is a specific need for Derbyshire where it's identified that you might want a poster in a different language or in a different format for any particular cohort or wherever that needs to be displayed for a particular audience, we can look into that. So please let me know if you would like us to look at that information and you know, make that a bit different so it's better to read for certain people.
And Harp has a second question. For those who are housebound or unable to make their way to a pharmacy and have their medication delivered, how will they know about what the pharmacy do besides their medication, etc.?
Another good question there, Harp, and I think again it's around how best we can get these messages out to people. So me coming here today is to try and raise awareness more with people across Derbyshire, and I'm again open to any suggestions around how we can best do that and we can reach everybody. Obviously taking into account it is difficult if you're housebound to be able to attend a community pharmacy for a consultation, and community pharmacies do have consultation rooms, and that's part of the service specification that they have to have that confidential private area to see a patient. Just to note that, really.
Next question is from Sarah. So for contraception and hypertension, are these planned or appointment led, or can you just turn up?
So you can just turn up. So you can just walk into your community pharmacy and ask about that service, and they should be able to offer it for you, provided that they are signed up to offer that service, which we don't see many pharmacies across Derbyshire that are not offering that service. But the ones that cannot are ones that don't have a consultation room. And there are only 2 pharmacies across Derbyshire that don't, and I believe they are in the High Peak and Buxton area. So provision is quite wide across Derbyshire to access those services.
Okay, Sarah has a second question. So for the pharmacy first part, Sarah's last personal experience of this was that the community pharmacy was extremely busy and there was an hour wait to be triaged. So she was wondering how community pharmacies are staffing these extra services. And as we all know, space at the community pharmacy can be limited. And when she was waiting, she was in a busy supermarket and it didn't seem very appropriate.
Thank you for feeding that in, and any patient stories that we've got of people that have accessed the pharmacy first service, we really would like to hear about those, positive or negative. We really kind of want to gather a picture, so that would be really helpful to us. So please do email with any stories. I'd be happy to pick those up. In terms of managing this, I think this is all very new. So everybody's adapting over the last year or so since this service has been put into place. And the staffing kind of will grow with the demand and need, I suppose. You know, community pharmacies are a business that has to ensure that they plan out what they need to do. So what we're finding is some community pharmacies are employing a second pharmacist to be able to manage doing the consultation work that this requires, as well as doing their normal day-to-day dispensing and private work or whatever they may do. When I attended a community pharmacy, I remember that particular pharmacy was offering a kind of booking system. So they would say, you know, are you able to attend at a certain time? We can book you in and we'll see you, because we know that we've got the capacity to see you at that time. That's when we would slot you into an appointment slot as such. So it is down to the pharmacy to manage the referrals that they get or the walk-ins that they get and triage those appropriately as to when they see them. But where that's not working well, we can always try and liaise, and we can look at what the pharmacy is doing to make that better, and I'm sure they'd appreciate that feedback as well.
Thanks,
Paula, you said for any personal experiences, positive, negative feedback and so on to be emailed. Where would that be to?
You can email that to me directly. We'd really love to hear some stories about the patient journey, and hopefully, get a good picture of how that actually works for people that access those services.
Okay, just so everybody knows, then I'll put Paula's email address on the Q&A, which will be posted onto the platform. So the next question is from Simon. Is there any way that the back of the prescription can be made easier to complete, and any fine messages, as this would be difficult for people with learning difficulties to understand?
So the back of a prescription is I suppose it's not kind of the topic that I've covered today. So unfortunately, I'm not really in the best place to answer that one. And that probably is a national template. So I'm not sure where to feed that back to.
Okay, thank you for that. The next one is from Rachel. If a person with a learning disability comes in, maybe because they have one of the 7 conditions you mentioned, would the pharmacist be in a position to remind or prompt them to attend for their annual health check with their GP?
That is not something that pharmacies, I don't think, have an obligation to do, as annual GP checks sit with the GP practice, is my understanding.
Okay, and we have another one from Simon. Should all pharmacy staff be trained on the Oliver McGowan training in learning disabilities and autism? As part of that, if you just mention what that training is for any of the viewers.
So the Oliver McGowan training is some mandatory training that we undertake in Derby and Derbyshire, and I think across the system that's been adopted in terms of understanding, having an understanding of patients with autism and learning disabilities, and it is really, really good training. A lot of people benefit from that training. And I think that's a really good suggestion. Community pharmacies are contractors. What we can do is share that training opportunity with Community Pharmacy Derbyshire, and if there is any way that community pharmacists can access that training, we can look towards sharing that out. So I'll take that on board. Thank you.
Yeah, we have another one in the chat, but we have a hand up. So Rachel, would you like to unmute yourself?
Hi, Paula. I just wanted to clarify my question, really.
Yep.
I'm Rachel. I work in learning disability services. I work for Derbyshire Healthcare. I'm a health facilitator. So our job is to support annual health checks for people with a learning disability. What we were thinking is that for some people with a learning disability, they may present in pharmacy with one of those minor conditions because they're not attending for the health checks or going to see their doctor for whatever reason. We know it's tricky to get appointments.
Yeah.
Would, in that situation, the pharmacist, be able to say, have you been for your health check? That's the question we're trying to raise and trying to improve kind of access for. So I've been trying all over to try and contact somebody to kind of say, can we publicise, can we put a poster up? But we're not having much look, really. So is that, I mean, I fully understand it's not within the scope of the community pharmacy to deliver the health check, but could they say, while you're here for your sore throat or your sinusitis, have you been for your health check?
That's something I could maybe take to the Community Pharmacy Derbyshire meeting for you, Rachel, and see whether that could just be something that.
Just all I wanted to do, and I've been all around the houses, and I'm sorry to overtake the meeting. I'd like to be able to just put a poster up somewhere and say you're entitled to your health check, or be able to say for the pharmacist, be able to say if they come in because they're not feeling very well, have you been for your health check?
Shall I pick that up with you? I'll pick that up with you outside of the meeting, Rachel, and we'll see whether there could be some messaging.
Thank you.
No problem.
Rachel, thank you for that. And you weren't overtaking. Part of the power of Derbyshire Dialogue is getting these ideas into the system, taking on the feedback, and hopefully getting some ideas which could improve things. So thank you very much for that.
Thank
so
you.
we have another question from Colin. Great question. Do you have enough community pharmacists for this plan? If not, it would be passing the appointment queues further down the chain.
This kind of plan, I suppose, is a national, nationally commissioned service, national plan, and so with that comes investment. So I suppose that's kind of out of our local hands in terms of it's been done nationally, and so pharmacies do have to kind of deliver this.
Okay, thank you for that. And I have a question, Paula, which I'd raise earlier to you, but I'll ask it for everybody else. So so all new community pharmacists, all newly qualified pharmacists next year will be able to write prescriptions for various things. So what about those pre-existing pharmacists? Will they be able to do so? Will they be able to upskill?
So in answer to that question, there is a course that pharmacists go on, an independent prescribing course that they would have to access to become an independent prescriber. And then they have an annotation next to their name on our regulatory GPHC register, which would alert everybody to the fact that they can independently prescribe. So to undertake that course, those courses are offered by learning institutions, some universities across England, and they would have to go on to that course to be an independent prescriber, and that course would have to be funded. So there may be funding streams that they can access that would be sort of cascaded out, or their employer would fund for them potentially to undertake that training. Would be the
Thank
answer
you
to
for
that
that
one, I think.
And Colin has his hand up. Colin?
Yes, Paul, I'm really not trying to be negative here, but
Yeah.
The fact that pharmacists can sign prescriptions, does that mean that they'll have sight of as much patient medical information as a GP to know what other medication they are already on, because or what medical conditions they've got? Because obviously if they prescribe the wrong medication and they've got a particular heart condition or whatever, then that could have really bad outcome.
Yeah, that's a really, really good question, actually. So what I can tell you is that as part of a consultation, a pharmacist will take a good medical history. So they'll ask you lots of questions and find out a little bit about the background to the complaint, etc. So there's kind of training around consultations in terms of things that you should cover in a consultation with a patient as to undertaking a good consultation. Another thing that the pharmacists in community pharmacy have access to, they all have smart cards to access the NHS spine to be able to look at what we call the shared care record, a national kind of nationally available shared care record. So they can see your shared care record with medical information on that. There's also a Derbyshire, so a local Derbyshire shared care record mechanism. And at the moment, we're working with our IP leads for the Pathfinder to try and get them access to the more local one as well, so they've got as much information as possible. But yes, all community pharmacists can access the shared care record and see information on patients, if that helps.
Awesome. There are no further questions in the chat, so if anybody has a question which they'd like to raise a hand for or put it in the chat, we'll just give you 30 seconds to do that. But I think we've had a very wide range of very useful questions in from everybody. Okay, so if anybody has any questions which you'd like answered afterwards, please do email Paula, whose email address will be on the Q&A, or email me at the engagement address, which everybody should have. So I think we're going to bring it to a close there. So first of all, wow, what a great presentation, and who knew, with everything that the pharmacists are doing for us, who knew? So many thanks to our main presenter, Paula Whitehurst, for a great presentation. I'd also like to thank the BSL interpreters, Helen Blunden and Emma Walker, for doing a sterling job as usual. The biggest thanks, though, is to our audience. Without you, we wouldn't have these sessions at all, and you've really brought in some fantastic questions today. Very, very helpful. And there's some things in there which may have some impact on moving forward as well. So looking forward, the next session of Derbyshire Dialogue is on the 21st of May. It's Dying with Dignity. As you know, in the news recently, there have been some contentious issues to do with dying with dignity. Lots of coverage there. So we're going to have a discussion to do with end of life. It's coming to us all, so we should all be invested in this subject. We'll be talking about what's happening in Derby and Derbyshire again, and an invite for that session will be sent out to everybody who's here at the end of today, when this session also gets uploaded to YouTube. So thank you very much for attending, and hopefully we'll see you next month. Thank you.
Thank you, everyone.
Many thanks.